Dr. Ranjan, where you said that there is a population that is going to, I want you to take, that point across and tell us what is it that indicates to you that this population or this person or this patient is susceptible, is prone to heart diseases, and also talk to me about, the importance of exercise, and is it something that, one size fits all, because we are all wearing our smartwatches that is telling us to walk 10,000 steps. Is that enough? A lot of women say, hum to ghar ka kaam karti hain, so that is equivalent to exercise. Talk to me about the correlation also.
Let's, create, let me use a real world scenario, right? I was doing a clinic recently in Noida, and I had a gentleman walk into my clinic, a very busy businessman, okay? And, he comes in a rush to the clinic just because I'm sitting there and he wants to get a checkup done. And then I check his blood pressure, it's 160 by 100, okay? Normal is 120 by 80. And then I ask him, how's your lifestyle? Do you smoke? Yes, I smoke. And he also chews tobacco. Okay. And then he's easily overweight. And then I asked him about his sugar levels. He said, I recently had diabetes, but I've been detected to have diabetes, but I'm not taking any medications. This is like, he's so casual about it. So this is just one example of how these patients, and this guy, mind you, he has easily about 40% risk of having a sudden heart attack in the next 3 or 4 years, easily. Okay, and this is just one example. Like this, we have numerous people in their 30s who are not watching their weight. They are just in a very fast lifestyle. Everybody wants to make quick money, quick living. We are living in a day and age where people don't have enough patience for everything. Health comes last, absolutely in the end. And then we ask ourselves, like, why is it happening to me? I was so good, I did everything, but at 35, because you're not looking after yourself. We don't prioritize ourselves. We only prioritize everything around us. And I'll give you another example, another 35-year-old, his friend died suddenly, so he came to my hospital to get it checked. And then I did all his blood tests and I got a treadmill test done, and there were some ECG changes on the treadmill, and his cholesterol levels were high. I asked him, and he also clearly was slightly overweight. I said, I think, your ECG doesn't look good. It looks like you're going to possibly have a heart attack. Can we get you checked? Can we do an angiogram? He thought I was dragging him, reeling him in to make some money. He clearly left. He said, none of this is all nonsense. I'm not getting anything done. Like, it is alarming. One, there is no awareness. Even if there's awareness, there's denial. And if nobody wants to take the corrective course of action. And unfortunately, because our youth population is so huge right now, and they're all getting fast into that age group where they're going to start seeing diseases, there's so many 38-year-olds, 36-year-olds who are already diabetic because of lifestyle problems, not because of family history, right?
Yeah, but all of us sitting here, we're not going to go to a doctor, right? Some of us will have to look at some symptoms, some indications. Who are the people who should see a doctor?
I feel if you're leading a sedentary lifestyle, you're eating a lot of extra food, especially from the outside, you are smoking, and and you have family history, then today, right now, you need to go to the hospital, get yourself checked.
All right. So if you have these 4 indicators, please do not hesitate to see your doctor of your choice. But also answer this question for me, Dr. Niranjan, that we all say that we have active lifestyles and, we don't really need to take our time to exercise, or I'm doing the 10,000 steps. Is that enough?
See, 10,000 steps is not a random number that's come up into circulation. It was actually a study conducted by the American Heart Association as well as ACC, American College of Cardiology, and they found out that there's a sweet spot. 10,000 steps equates to about 800 calories per day, and that is what is said to be the sweet spot to call yourself active in a day. And that's why that 10,000 steps came into the picture. and it is directly linked to reducing your risk of heart disease by at least heart attacks by at least 5 times. Reduces. So that is why you have to be active. Now, for people who say I work all the time in the house, there is no quantitative measurement of how much you work. It could be one person working throughout the day and maybe even more than 10,000 steps versus somebody doing, some moderate amount of work just twice a day, which is not even, worth burning 200 calories, so to speak. So it's a very quantitative misconception.
Got it. Understood.